Hi everyone, so it is 9 o'clock, so we'll get started. My name is Adriane from the New England QIN-QIO. Good morning. I just wanted to welcome everyone, and I'll be moderating for today's webinar. Thank you for joining us. The webinar today is called Self-Measure Blood Pressure Program in New Hampshire. Before I hand this over to Adriane, I just wanted to quickly review a few housekeeping items. This call will be recorded for training purposes. I'll provide you with details on accessing the recording at the end of this webinar. The phone lines will be on mute for the duration of the presentation, and when the opportunity to ask questions come up, I will provide you instructions on how to unmute your line, or you can pose a question in the chat box. Please just make sure to address the question or the chat to all participants. At this time, I'd like to introduce today's speakers, Georgette Verhelle from the New England QIN-QIO, and Adriane Burke. Adriane is the Health Systems Coordinator for the New Hampshire Division of Public Health Services. Adriane, the floor is all yours.
Great, thank you, Olivia. As Olivia mentioned, my name is Adriane Burke, and I work for the New Hampshire Division of Public Health Services. I've been communicating with quite a few of you over the last couple of weeks. So thank you again for joining us this morning, and we're really looking forward to working on this project with you. To get started, I'd like to have everyone introduce themselves in the chat section on the right side of your screen with your name and the organization that you work for. And Olivia, can you get to the next slide, please? We'd like to acknowledge that most of the content of this presentation is adapted from the American Medical Association and Johns Hopkins University booklet that we had originally sent to you. If you'd like some more information or you'd like to look at the content, you can use this link. And then I'd like to introduce Georgette from the New England Quality Improvement Organization, who has been helping us on this project. Georgette, please tell us a little bit about yourself and your organization.
Hey, good morning, everyone. Olivia, could we go to the next slide, please? Great. So the New England Quality Innovation Network or Quality Improvement Organization, also known as the New England QIN-QIO, consists of the 6 New England states, and Connecticut, New Hampshire, and Vermont are overseen by Qualidine, which is our mother company down in Connecticut. And we subcontract with health-centric advisors out of Rhode Island who actually hold the contract for all of New England. Many of you may have worked with Northeast Healthcare Quality Foundation in the past, who held the contract for Maine, New Hampshire, and Vermont for more than 30 years. This is all new to the QIO world, where we went from 43 QIOs down to 14. Next slide. And this is just our website that you can visit. There's a wealth of information on this website, as well as all the previous webinars that we've done. Next slide. And this just shows you the opening page. Here is highlighting for providers. This is our home health opening page. Next slide, please. That's back to you, Adriane.
Great, thanks. And here's just a quick overview of the Division of Public Health Services. As you can see, the Division of Public Health Services is underneath the Department of Health and Human Services, and then I sit within the Chronic Disease and Prevention section, which is underneath the Bureau of Population Health and Community Services. And we are committed to achieving true improvements in people's health by encouraging healthy personal behaviors, and so this is where the SIVP's program sits. Next slide, please. The objectives of today's webinar, we're going to do an introduction. We're going to talk about some of the program and reporting requirements, and then the resources that are available to you throughout this next year. Next slide. Georgette.
Thanks. So many of you might say, why bother to participate in a self-measured blood pressure program? Well, next slide, please. So home monitoring can give you many readings over time with fewer office visits, which can always help to determine if a change in therapy is needed. It can also help to prevent overtreatment.
It improves blood pressure control, especially when used with clinical support, such as telemonitoring or remote counseling. It can improve adherence to antihypertensive therapy. And one of the other things that it can prove or disprove is white coat syndrome. Next slide, please. Patients should always know what to do if they have a blood pressure measurement that is outside your agency's acceptable range. So you need to set those parameters early on and be very clear with your patients. If they experience any symptoms with high or low blood pressure, and it should include seeking emergency treatment if necessary. Whenever you enroll somebody in the self-measurement blood pressure program, they need to receive individualized guidance from providers that is definitely reinforced by your clinical staff. Next slide, please. So this is just some examples of patient selection criteria. They've been diagnosed with hypertension, and maybe they have a blood pressure that's greater than 140/90. The first and additional visits to your office. Be sure that the cuff that you have that you're providing to your patients is the appropriate size for them. They need to have the ability and willingness to be able to complete this at home. So when you're deciding on who you want to do the self-monitored blood pressure program, you need to be sure that they're comfortable doing this and that they perform it accurately in your office. Next slide, please. And, of course, communication is the most important piece to this. The patient needs to report their self-measured blood pressure readings back to the provider. Otherwise, what's the point of even doing this program? Next slide, please. So there's many ways that they can communicate back to your office. You're going to need to establish what the best way would be for you. Maybe you'll have a champion in your office that the patient can call and provide their readings to. They can fax the readings to the office through a secured fax number. Maybe they can go through your secure patient portal and report that way. And then there's other things such as the American Heart Association's 360 tool, and there's a website for that. And they can also just report back at their next visit if that's going to work for you. Next slide. Back to you, Adriane.
Great, thank you. So as we highlighted in the original application, there are a few program and reporting requirements that we're asking for you to do. The first is a written procedure, which highlights how the monitors will be used. We're asking for you to identify patient education materials, teach the patient how to use the monitor, and then report back as data so we know what is being accomplished and who and allow us to identify any future opportunities for FMBCQ. Next slide. So going a little bit further into the written procedures, we think that it is important that you have a manual that basically tells you how these monitors are going to be used, who's going to receive the monitor, and under what conditions they're going to receive it, whether they're going to be sent out or given out, how patients are going to be trained on use, and how they should report back their results, as Georgette just spoke to. And then where will the readings be kept, among other things. So as you go through this process, just keep in mind some of the resources that we're going to give you throughout here, and remember that we'd like for you to give us a copy of your procedure manual once it's complete and before you start the program. I've received a few already, but I'm still waiting on the rest. Next slide. So we have many resources available to you. These were sent out originally with the application, and then again when we notified you that you were enrolled in the program. So this is an example of a patient enrollment process that you can use in your own clinic. Next slide, please. And then this is an example of a loaner log that you can use and adapt to your own clinic use. Next slide. And then patient materials. There are tons of patient materials available in the documents that we sent. Here you can see there are documents on a hypertension overview, how to take your blood pressure correctly at home,
And there are lots of other things, so please take some time to look through the documents and see what might be useful for you in your own clinic. Next slide. And then here at the Division of Public Health Services, we have a few other resources for you or materials for you. On the left, you can see a DP wallet card that I'm sure many of you have seen in the past. I have a whole bunch of these, and I'm willing to send them out. Here you can see the front and the back of it, and then it folds into sort of the size of a credit card. And this gives the patient something to carry around with them to mark their blood pressures down when they're out and about. And then on the right, we have all of these, we have a whole bunch of these bags that I'm happy to send out to you. We thought they might be useful to put their blood pressure monitors in to give to patients. So if you're interested in either of these, please email me. You can find my email information at the end of this document if you don't already have it, or at the end of this presentation if you don't already have it. Next slide. And then for data reporting, I'm going to send out a Survey Monkey in May and again in October. And the Survey Monkey is the same way that you apply for the program. And we're looking for phone information back from you. Specifically, we want to know how many patients have received the blood pressure monitor. And this will vary depending on whether you're doing a donor program or you're just giving them out. And then for what reason patients are receiving them. We also want to know whether patients are reporting any information back to you. And then again, any identified challenges or successes that you had. So this will help us in the future if we continue with the program. And then I'm going to do an end of the year call with each clinic to again talk about the program and see if there were any challenges that you had and how you think we might be able to improve upon the program in the future. Next slide, and Georgette, it's back to you.
Hi, thanks, Adriane. So, like I said earlier, many of you are familiar with the QIO world here. We can do a lot of things to help you in your clinic or home health agency. We can do PowerPoint presentations, lunch and learns on how to take a blood pressure correctly. Also, how to check a home blood pressure test for accuracy, working with your patients. We can also help you with any dashboards, developing spreadsheets and other materials, provide technical assistance. There's a whole bunch of things we do here. In addition to all of this, part of the QIO work is also focused around NACRA and MIPS, so just keep that in the back of your mind if you need some help moving forward with all the changes coming into healthcare. And many of you know that we work with the hospitals, home health agencies, nursing homes, and physician practices across the state on all kinds of quality improvement projects. And so we're here to help you in any way that we can. Next slide.
Okay, and these are some of the resources that we have available for you, the AMA and Johns Hopkins Guide, and then some of these booklets from the Million Hearts program. So with that, I think that's the end of our formal presentation, and I'd like to open it up for questions.
So, Adriane, this is Olivia. If anyone does have a question, you can press #6 on your phone to unmute your line, or you can pose a question in the chat box. Again, it's #6 to unmute your line. All the lines are automatically muted, so you just need to press #6 to unmute. Hi, I have a question. This is Diane Trowbridge from Manchester Community Health Center.
Yes.
Could you tell me, please, if the patient education materials, I haven't had an opportunity to go through it yet, are they offered in languages other than English?
This is Adriane. I don't believe that the patient education materials that we have in these documents are offered in the other
in any other languages, but I can definitely take a look and see if we have anything for you that you can use.
Yeah, this is Georgette too, and I can consult with other states and see if they have things. I think Rhode Island might have something available. We'll definitely get that and provide that to you. Thank you.
Adriane, it looks like there is a question there are some questions in the chat, if you wanted to address those.
Let's see. So I believe that one or two other clinics have done FNDT projects in the past. I don't know if anyone is on the line that would like to speak about their successes and challenges and sort of their process for going through the FND project. I think it would definitely be helpful for everyone to hear about what you've done in the past. No? Well then, let's see, Sandra, I can try to put you in contact with someone if you're interested, to talk about what they might have done in their clinic that would be beneficial to you. And then how do we get multiple copies and colors of the education materials? I can definitely print out some of the materials and send them along to you, unless you want to take some of the documents that are in these resources and adapt them to your own clinic. These are definitely branded for AMA and Million Hearts. So email me and let me know what you would like me to do, or speak up now.
And I think Conway, the training, Zoe, are you looking at the twin quota come up? Because we could definitely do that within the next couple of weeks. I think by the end of next week for sure.
Great. Any other questions? All right. Well, I encourage everyone to send along their guides and their manual about how you're going to run your SNDT program. And we're looking forward to working with you. Please don't hesitate to reach out to us if you have any additional questions. We're happy to help, and we're here if you need us. Georgette, do you have anything to add?
No, you see there's my email address at the bottom of the last slide. We will have these slides available. Olivia, do you know what the time frame would be to have the slides available for everyone?
The slides can be available right away. The recording itself usually takes a few days since we need to get that from WebEx. I would give it a week maximum. So I can send the slides out right now, or I can send them out together in probably like a week, whatever is easiest.
Let's send them out together.
Okay, no problem. I can send that out to everyone who is registered for this in about a week, and I'll make sure to send it to you, Adriane, as well as Georgette, so you can send it out to anyone additional.
Great.
Sounds good.
Great. Well, thank you so much for joining us today.
Thank you. Have a great day. Didn't want to take up too much of your time, so take care.
All right, thanks everyone, and I do have the chat log, so I will send all these questions and requests to Georgette and Adriane.
Good.
All right, thanks everyone. Have a great day.
The reader has disconnected. The conference will be terminated in 5 minutes.